my name is Dr. Alamo. I'm a medical director of ProCare Family and Occupational Medicine, and this is Ask a Doc. What wellness test should I have? And that will depend of your age group. If you're younger, pretty much everything works. It's like if you have a new vehicle, you pretty much put gas and take it to the oil change once in a while, what it says, and you're good to go. If you have a vehicle that is 10, 20 years, well, there are parts that you have to change. There are parts that you have to replace, and we have to check them more often because they can get damaged. Besides, if you're a female or if you're a male, there are tests that are more required to you. If you are in your 40s, well, now, as I was mentioning before, those machines started not to work that perfect, and you start having risk of other things like cancer, high blood pressure, diabetes. Why do they increase? Well, I tell patients I didn't have these wrinkles when I was younger, and now my body has less fluid, it's less elastic. So we start having things that we didn't have before, like the blood pressure. And we start being more concerned about your kidneys, your liver. So we check those generally once a year. We check your cholesterol, your triglycerides. If you're a female, then you are 40, you are 50. We start thinking about cancer, and we check for that accordingly. For females, we have to do the mammogram. How often do we do the mammograms? Every year, please. We used to say that palpation was important, and we no longer say that because the best fingers, the more trained fingers, are not as good as a machine and a computer. We need you to get a mammogram. Does it have boobs? No, it doesn't have boobs. But if my mannequin had boobs, I would show you. There is no way that I can touch those. So the mammogram is important to be done every year. And after 50, colonoscopies or colon cancer screening becomes important, and we like that depending on what are we doing. If we are doing a colonoscopy every 10 years, if we are doing something that we have been doing lately, which is the Cologuard, is a poop test, and we check the DNA in the sample, that we can do it at every 3 years if that is normal. Next question, how can I eat a more nutritious diet? Well, think about if you have a car. Most people have cars, and if you have a car, you think what the manufacturer require for that car to run. Well, most cars run on gasoline, so you put gasoline. You wouldn't think about putting sugar in the gas tank of this vehicle, would you? Probably not. Well, think that the one that invented this machine a couple of 100 million years ago, well, they were planning for us to be fed from what was available there. Vegetables, fruits, there were no McDonald's, Burger King, Whataburger, nothing of that was planned for this machine to work perfectly. So how often should I schedule an appointment? And that also it has to do with the age group. If you tell me you are 18 years old, you don't need an appointment with me. Seriously. As we grow older, the appointments every time are more frequent. So at the beginning, we recommend every 3 years. You are in your 20s, it's good enough. If you are in your 30s, in your 40s, annually is a good time. We don't necessarily need blood work at that time, but we need to check your heart rate. We need to check your blood pressure. And in your 40s, on your 50s, definitely yearly. And in your 60s, 65, generally we see those patients every 3 months. And every 3 months, we basically it's going to be a quick visit and check, is everything going well? And they say yes. How about this, and you go home. So it's a brief checkup, and those patients will have at least one comorbidity that we have to address, and in those, yes, we will get blood work depending on the conditions they have, once a year or twice a year. If you have anything in particular, the frequency may be more, but generally speaking, that one. What are my risks of developing heart disease? And that also depends on the age group. I always tell patients, if you are a male, you have more chances of developing heart disease than if you are a female. If you are over 40, you have more than if you are less than 40. If you are obese, you have more chances than if you have obese. And if you have the comorbidities, high blood pressure has more chances. If you have diabetes, you have more chances. And if on top of that you smoke, you have all of them. So the more risk factors that you have, the higher the risk of having high blood pressure. There are some of them that we can modify. We cannot change your sex, you cannot change your age, you cannot change some things, but we can change the risk factors that are related to your habits. We can make you less overweight, we can make you exercise more. Exercising is excellent for your health. Why should I check my blood sugar numbers? Imagine a glass of water, and the glass of water is supposed to be clear, crystal clear. If we put a little bit of sugar is okay in that glass of water, but a whole lot of sugar is not okay. Imagine that is the blood in this mannequin. That is the fuel of that mannequin. When we make that fuel too sugary, there are processes that don't work as they were supposed to. So we have to check those numbers regularly. Same as I said in the previous question, once a year, once every couple of years is more than enough. And if we know that the process that regulates that has to do with the pancreas is not working well, we have to check more often. If you have been diagnosed with diabetes, definitely we have to check those every 3 months. What can I do for seasonal allergies? That's a tough one, because seasonal allergies is something like acne. Acne, if you're predisposed to have acne, you're going to have acne when you're 15, 16, 17, 18, and we have to manage your expectations at that time. At some point, you're not going to have acne anymore. Same thing with seasonal allergies. We have a season, and in West Texas, that is around April, around March. February, with all this wind, we have more allergies than other areas of the country. I personally recommend to take most of the medications that are for allergies these days are over the counter, and we have 4 main that we use. I recommend to switch them and rotate in between them. Sometimes you get used to it. You get used to use loratadine, for instance. Some patients take loratadine for 3, 4, 5, 6 months and they get used to it. So I recommend to rotate. And when the season is over, you will be over. Many times patients go to our clinic. We can give you a steroid shot, but we will improve in May. It will improve in June, I promise.